Hello and welcome to Medical Oasis, and to the third lesson of Hematology chapter. I am Dr. Eve and I will be covering today the topic of macrocytic anemia. So let's get started. Macrocytic anemia is defined as anemia that has a high mean corpuscular volume, and a low reticulocyte count. It is caused by megaloblastic diseases, in which there will be a hypersegmented neutrophils, such as vitamin B12 deficiency and folate deficiency. And also by non-megaloblastic diseases, such as liver disease, alcohol consumption, medications such as cytarabine, azithromycin and 5-fluorouracil, and metabolic conditions like leishman and hereditary uric aciduria. I will go through each of the causes in detail, so let's begin. As we all know that vitamin B12 is required for proper red blood cell formation, neurological function, and DNA synthesis. It is naturally found in animal products, including fish, meat, poultry, eggs, milk, and milk products. For an adult, the daily requirement of vitamin B12 is 2.4 micrograms as it is being absorbed in the terminal ileum. Keep in mind that the body has 3 to 10 years of storage. That's why vitamin B12 deficiency takes a long time to develop. Vitamin B12 deficiency occurs due to either decreased intake, as in strict vegans, or due to reduced absorption, as in pernicious anemia, Crohn's disease, and gastric bypass. In addition to anemia symptoms, there will be neurological symptoms such as numbness, or tingling in the hands, legs, or feet, ataxia and weakness, and difficulty thinking, or memory loss. Diagnosis is made with blood smear that shows megaloblastic anemia followed by measuring B12 level. If the result is still suspicious and unclear, then we move to the next step, which is by checking the methylmalonic acid level. Low if it is elevated, then it is indicative of B12 deficiency. The treatment of choice is with oral B12 supplementation. But in case there is impaired absorption, then the supplementation must be intramuscular. So now and after we have been through the B12 deficiency, let's move on to the second main cause of macrocytic anemia, which is folate deficiency. Folate, also known as folacin, is naturally found in leafy greens such as beans, lentils, asparagus, spinach, broccoli, avocado and so on. It is necessary in the formation of red and white blood cells in the bone marrow, converts carbohydrates into energy, and produce DNA and RNA. Adequate folate intake is extremely important during pregnancy, infancy, and adolescence. Hence that the body has 3 to 6 weeks of storage. That's why it often presents with higher acuity than B12. For the presentation, there aren't signs and symptoms other than the anemia itself. The diagnosis is made with a blood smear that shows megaloblastic anemia, followed by measuring the folate level that will be decreased in case of folate deficiency. We treat folate deficiency with oral supplementation. Note that, in pregnancy, folate supplementation must be given to prevent neural tube defects in the fetus rather than to protect the mother from anemia. Now for non-megaloblastic, there isn't really that much to talk about except the list of causes that I mentioned earlier. Be attentive, that it's important to first rule out megaloblastic causes, then look for non-megaloblastic causes. In the end, I would like to summarize this lesson workup into a few steps in order for it to be easy for you to remember. Okay, let's assume that we have an anemic patient with high mean corpuscular volume. So what to do next in order to know the underlying cause? Well, the first thing to do is blood smear to know whether it's megaloblastic or non-megaloblastic. If it's megaloblastic, then we measure B12 and folate levels. If the results is equivocal, then we have to move to the next test, which is methylmalonic acid that will be elevated in B12 and normal in folate. Finally, we have reached to the end of this lesson. I hope it gave you a clear idea about macrocytic anemia. Thank you for your listening and see you in the next lesson. Don't forget to hit the like and share buttons. Ciao.